Alrighty, it is 8:31. So I'm Tonda Wooten and I sit on the ACFAS Fellowship Committee. Thank you all so much for being here, for our directors for being here, and our residents and students here. We'll get started here. If any questions pop up along the way, feel free to use them in the question and answer bubble, and we'll try to get to all of those this evening. Otherwise, we'll go ahead and get started. So the first program we're going to hear from is the MedStar Georgetown University Hospital Foot and Ankle Research Fellowship, and we have the director, Jayson Atves, with us tonight.
Thank you so much, Tonda. I'm going to share my screen and we'll get started here. As you had mentioned, I'm here representing the MedStar Health Georgetown University Hospital Foot and Ankle Research Fellowship. And again, thanks so much to the college for providing these kinds of resources, both for ourselves as well as for the residents and students out there. Really to showcase our fellowship in particular. We are a research-based fellowship, one of very few research-based fellowships within the nation, specifically for foot and ankle surgery, which we as faculty and honestly reports back from our fellows is really seen as a major advantage because it does afford us quite a lot of flexibility in offering really kind of top-tier educational experience for our trainees. The area is located right in the District of Columbia, our nation's capital, primarily at Georgetown University Hospital, but certainly the area is quite vibrant and certainly has a lot to offer, be it for DC, Maryland, or Virginia. We have quite an extensive faculty, which again is primarily based at Georgetown University Hospital with myself and my partners, as well as very many others within Georgetown. But there are absolutely opportunities to get experiences at some of our sister institutions, both in DC as well as in the state of Maryland. Our centers, again, as I said, is primarily centered at Georgetown University Hospital in Washington, D.C., which there is a plethora of experiences. One of the primary things that we relate to some of our incoming fellows is that to take advantage of all of the opportunities, be it in clinic, be it in research, be it in the OR, is really unfortunately very unfeasible because there's just so many opportunities available. Again, whether that's in clinic, that's in the OR, or some type of research base. Our health institution, or health system, I should say, is one that is the largest on the Eastern Seaboard and really encompasses over 1,000 residents and several dozen fellows that are supported under various types of specialties, of which foot and ankle surgery is just one. And again, our centers and locations are kind of widespread throughout the area as well. Our program history, this is actually our 17th year that we're currently in as far as our research fellowship. And our current fellow is still on the hunt for a job, but I will tell you from my experience, will be well poised to have a fantastic position. But I think it's currently looking throughout the Midwest. As far as our experience overall, certainly the opportunities that are available both within Georgetown University Hospital as well as just within the MedStar health system are quite extensive. I would say that, again, primarily the fellowship is based within Georgetown University Hospital, but there are just numerous other opportunities that exist, whether it is that you want to explore other opportunities in research with foot and ankle, with orthopedics, with vascular, with plastic surgery, or if you have any other additional types of interests, it's certainly something that's supported extensively within our institution. As is mentioned here in our pamphlet, and as I mentioned before, there is just an enormous amount of flexibility and opportunity that's really available within the fellowship itself. And certainly tonight, with just a few minutes to speak on it, I think I'm probably underselling it, but suffice to say that this is a very fellow first type of experience, one that we take extraordinarily seriously, and we really do try to provide all of our trainees with as top tier type of educational experiences as possible. Our one mandate is, as a research fellowship, that we do want you to spend at least 51% of your time and your energy actively participating in research, whether that is sitting in a cubicle pumping out papers, which is what some fellows choose to do. But I will tell you, myself and the rest of our faculty are very supportive of more of a well-rounded type of experience where you're certainly putting in a lot of time and effort into performing research, but more so is following up and creating ideas, as well as seeing patients in our clinic, as well as in the operating room, and really sparking on discussion, which is, I would say, primarily the nidus for many of the research projects that we have, is just multidisciplinary discussions, for which the fellow can be a mainstay type of a feature. Experience overall, again, there are some minor clinical duties, major educational duties, and really the surgical duties are such that you have lots of opportunities, but there are no specific surgical or clinical duties. The fellow really doesn't have to put in any orders. You don't take any call, but again, there are primarily strict duties and strict restrictions for what we have for research overall. One of the benefits that our health institution and our fellowship ascribe to is trying to make research that much more accessible and easy to perform. So we have gone through the rigors of obtaining what are known as global IRBs in perpetuity. So if there's any type of project that you want to push forward with that is retrospective in nature, the IRB is already approved and will be approved in perpetuity into the future. But we certainly, again, want to make sure that that's a very stimulating and challenging type of experience, one that you can succeed at. We do require a minimum of 2 national or international scientific meeting presentations, of which the ASC can be one. And we require a minimum of 4 quality submissions for publication throughout the year, which is certainly in excess of what's required by the college, but that's certainly something that we want to perform above and beyond what's required of us. And that's generally something that most of our fellows have completed within the first 6 months of the fellowship itself. Here's some more requirements that you can kind of skim over, or if you have any other interest, I'm happy to talk with you or communicate or connect you with our current fellow or past fellows. But again, just kind of reiterate all of the types of resources that do exist. Again, we are a very large health system within the Eastern Seaboard. Very fortunately, MedStar Health provides quite a substantial amount of support for all of our trainees, and quite literally every one of our institutions is an academic center, but certainly Georgetown University is kind of our flagship. And we're very fortunate to have MedStar Research Institute available, which again, for lots of different resources, be it for specifics of research projects or generalized information for the health system or research in between is certainly very much available. One of my particular interests from previous life and previous profession is actually gait analysis, which for myself and for my partners has really become kind of a mainstay feature of what we're trying to accomplish and what we're trying to show within not just our literature, but within our outcomes as well. So we do have a pseudo makeshift gait lab that is available for performance of research. And at this point in time, we have, I think, over 800 subjects that we can pull data from as well. Again, these are all of the generalized research topics that we ascribe to. These are all my cases and several and lots of overlap between my partners as well. But again, certainly not limited just to myself or to my partners, but there are lots of other opportunities to scrub, to learn, and to publish. And that's primarily our real goal here, is to make sure, again, that you have an educational experience that's really second to none. So if you have any additional interest, feel free to reach out. Happy to speak on anything additionally or connect you with our current or former fellows. And again, thanks so much for the time and very much look forward to hearing from people.
Awesome. Thanks so much, Jason. I just have 2 questions for you. What is the start and end date of your fellowship?
Yeah, our fellowship does start a little bit later. Our start date is August 1st, and our end date would then to be July 31st, but we have a little flexibility with that as well, because I know people are starting jobs and traveling as well.
Perfect. And then does your program accept H-1B visas?
Great question. I do get that every year, at least once or twice. We unfortunately do not support visas. MedStar Health is very strict on that, but we are able to accept anyone from the States originally.
Awesome. Well, thank you so much.
Thank you.
All right, and up next we have the Nebraska Foot and Ankle Reconstructive Surgery Fellowship. This is with Dr. David Waters.
Hello. Can everybody hear me okay?
Yes.
Awesome. Great. I'm Dr. Waters. I'm glad to be here. Glad the college gave us some time. I always enjoy these Zoom rooms every year. So I'm going to turn the time over to our two fellows, Dr. Webb and Dr. Brico, to kind of talk about the fellowship, and I'm happy to answer questions at the end, but glad to be here, and I'll leave it up to our two fellows.
All right, good evening, everyone. Next slide, Dr. Webb. So who we are made up of 5 core faculty. We have Dr. Waters, our director. We work very closely with Dr. Joshua Ray, Dr. Evan Leonard, who is our first fellow, Dr. Donald Buddicky, who's very involved with the college, as well as Dr. Avery Mason, who was last year's fellow. So it is a small group of attendings that you work one-on-one with and have mentorship with these attendings. Next slide, please, Dr. Webb. Dr. Webb and myself are the 2 current fellows. Dr. Webb comes from the Rochester Regional Hospital program, and I come from Henry Ford Hospital out in Detroit. We are, for the first year, taking on 2 fellows per year. Next year's fellows, Dr. Juan Castillo is coming from the Rochester Regional Hospital in New York. And then Dr. Nan Tran is coming from Central Michigan University out in Saginaw. This currently, this is our 4th year of the fellowship. These are our previous fellows. 2 have stayed within the state of Nebraska and practice here as well as work with the fellows. So where we are, we're located, like I've said, and the name says, is Nebraska. We are the only fellowship in the state of Nebraska, Kansas, and South Dakota. We do cover the majority of the state of Nebraska. The furthest west we go out is Sidney, Nebraska, and north we go all the way up to Norfolk, and then south we go down to Falls City. So we do cover a large amount of the state. We do a decent amount of rural medicine, which has been great if you're not exposed to any of that. Dr. Webb, anything to add?
Yes. So I love that we're able to access such a wide variety of rural areas as it gives us access to great pathology. Each region, including Western Nebraska, brings a lot of Clovis foot, and then just also a lot of farmers that don't take care of their deformities and they develop over a long time, giving great opportunity to learn about pathologies and also just rear foot reconstruction.
Awesome. Next slide, please. So our fellowship offers a high volume, high hands-on experience. We focus on complex deformity correction, corrective, elective, reconstructive, forefoot and rear foot surgery. We do total ankle arthroplasty, trauma. We've got revisional surgery that we do across multiple sites across the state. Fellows do work closely with experienced faculty, like we've talked before, both in clinic and the OR, slowly gaining autonomy while refining our surgical skills and decision making. The program does emphasize a strong teamwork culture, academic involvement. We do require research, and you do get real world practice readiness in terms of managing complex pathology in clinic as well as in the OR. From my perspective, our fellowship, like I've said, we have a high volume experience, both tons of reconstructive elective surgery, both in forefoot and rear foot. And what really sets us apart is the mentorship you get. You're not just operating with these attendings, you're constantly being taught how to think, plan, and execute at a high level, both in clinic and the OR. You're constantly getting pushed to improve and to do better. There's a heavy emphasis on developing clinical judgment and surgical confidence. So that way, by the end of the year, you feel prepared to independently manage all these complex cases and then go off into practice on your own.
I just want to add just one thing to this is Dr. Brico said the mentorship is excellent at our program. I think one thing that I've really appreciated as well is just not only being able to see the advanced reconstructions and the complications, but being able to manage them both in the clinical setting and the OR setting, and being able to kind of piece all of that together. So you're not only just having the one experience in the OR, but you're also having the experience of working it up on the other side as well. I think that brings a lot of benefit in order to, at the end of the day, you have to get these patients to the OR and be able to work up these deformities, work up these complications, and being able to use your brain and be able to present treatment plans that are appropriate for these patients are critical. And I think this fellowship does an excellent job to be able to give us those tools and those skills.
Next slide. Next slide, Dr. Webb. So we do have our weekly academics, Wednesdays at 5:15. We have our QR code that you can scan and fill out the information. We can add you to our mailing list. If you have any questions, you can always reach out to myself or Dr. Webb at the fellowship email. It's fellowship@prfootandankle.com. We'd be more than happy to answer any and all of your questions.
Awesome. Thank you guys so much for presenting. I just had a question for you, Dr. Webb and Dr. Brico. What is the dynamic like with having two fellows? Like, are you guys doing cases together, or is it like academics or running cases past each other? What does that look like with two of you guys there?
In terms of, we rarely double scrub or see each other in the OR. We do run cases past each other and talk to each other about our cases. In terms of volume, both of us are usually in the OR at the same time, so that doesn't really end up being an issue. And academics, we actually switch off back and forth each month, and but we really do tag team a lot of it in terms of learning, and it's nice having someone else that is going through it with you, and to have someone that understands what you're doing and can offer insight on cases and clinic and just another person to lean on.
Yeah, and we just have a question in the Q&A, and it just asked what to give a little bit more insight on what the call schedule is like, and then kind of like a normal week, how many days are typically spent in the OR versus clinic.
Call schedule, currently we do take call at the local hospital in town at Mary Lanning and Hastings, and that's usually cold trauma, cold things. Rarely do we get called in for emergently, so we are on call there, as well as we do take twice a week or twice per quarter, we take a trauma week at one of the hospitals out in Lincoln. And so that you share with the entire practice. It's the fellows plus the rest of the practice.
Nice. And then just briefly, what does a normal like week look like for you guys in terms of clinic days versus OR days?
Yeah,
I would.
so I can answer this. So in terms of the OR, usually 3 to 4 days a week you are in surgery, and then 1 to 1.5 days you are managing a clinic. There's an actual fellowship run, like a fellow run clinic as well, that the fellows get opportunity to practice some autonomy, which I find nice that we can be able to book our own cases and be able to practice our own workups as well.
Wonderful. Well, thank you guys so much for being here. And then we'll send out the form tomorrow with this email address. So if anyone has additional questions, they can reach out to you guys.
Awesome. Thank you so much.
You're welcome.
Yeah, thank you.
You're welcome. Okay, and so next we are going to hear from the Orthopedic Center of Florida Foot and Ankle Fellowship. This is in sunny Florida, and we have the program director, Dr. Andrew Belis, with us, and I believe his fellow as well.
Yes, thank you. It's Belis. I know
Oops, sorry about that.
it shouldn't be pronounced that way, but it is. And we have Dr. Husick with us as well, and I'll let him chime in when we can. Dr. Husick was kind enough to send me or help me create a PowerPoint, so I'm going to share that if that's okay, real quick, and that'll help guide us through this little process. And there'll be plenty of opportunity for him to chime in as well. Okay. So again, my name is Dr. Andrew Bellis. I'm originally from New York, but now we practice in Fort Myers, Florida. Beautiful, sunny Fort Myers, Florida. Although it's pretty cold right now. It's 60 degrees. Not that cold, but it's cooler for us. Our current fellow is Dr. Ridvan Husick, and he's doing a great job. We're really proud of him. And basically, we practice at a multi-specialty orthopedic group. And let me see if I can just advance this slide for a minute. There we go. So that's me. For some reason, I have a really long beard in this picture, but that just means I have a lot of wisdom and a lot of experience doing this. This is my email. Feel free to email me at any point. And basically, we've been recognized with ACFAS for quite a bit of time now. And so I think the biggest thing that you want to consider when you're looking at a fellowship is who your mentors are. And so, I do provide about 25 years of experience doing this. I've practiced in podiatry only practices. I've practiced in a multi-specialty orthopedic group. We have hospital experience. I've had multiple leadership roles in our profession, and including past president of our state. I have a lot of conference experience with running conferences and educational events. I'm on our scientific committee, and I put together the lecture tracks for a lot of the the surgical aspects of our meetings. I'm also co-founder of the Fellowship Society of Florida. What that is, it's a collaboration of fellowships in the state of Florida that was kind of our brainchild, myself and Dr. Perler. And we had the idea of trying to collaborate and improve the overall experiences of all the fellowships in the state of Florida. So that experience has allowed for webinars and other collaborative efforts. So that's the goal of kind of trying to help the fellows, is to try to expand their experiences as well as their network. I've also had medical legal experience and do consulting experience with multiple industries, so I can give some insight into these situations. Financial planning experiences, as well as I'm a family man, so I like to say that our fellows are like my kids, and I want them to do better than I did. So that's kind of my mantra, and I try to give them all the resources they need to experience that situation. Uh, so these are our adjunct faculty. We have Dr. Michael Black, who's fellowship trained from Seattle area. We have Dr. Kleiman and Dr. Patricia Nicholas, who's non-surgical at our practice. And then outside of our practice, we have several docs that are contributing to the faculty. We have Dr. Jayson Nemitz, who's a board-certified orthopedic foot and ankle surgeon at another one of the adjacent practices. Dr. Brent Bernstein, who's a wound care specialist at the hospital, and Dr. Austin Mishko, another wound care specialist who's newer to the area. So there's lots of younger and older and middle-aged experiences that you can rely upon for experience. The overview locations. So we have our main clinic, which is in the Orthopedic Center of Florida, Fort Myers, Florida. We have Estero offices in Naples. We usually use, there's one major system in town, the Lee Health System. And so the fellows are asked to have coverage there and take call from the hospital there. Dr. Husick, how's your call schedule at the hospital?
Yeah, so call is usually 1 to 2 days per month, and that's at all of the Lee Health hospital systems, and there's about five in town. And call could be anything from, a diabetic foot ulcer to, ankle fracture, and various other trauma that may come in. And so that's been a great experience. And those are cases that you can, if anything needs to go to the operating room, those are all cases that you can log as a primary surgeon, and they can be counted towards your boards.
Great. Luckily, I've kind of gotten into this lucky experience where I've worked, where I've kind of gotten out of taking call at the hospital, which is actually pretty good. But most of our cases are that I book are through elective cases, and I usually work out of Gladiol Surgical Center, which is our main facility. So about over 90% of the cases are being done there. There's the other surgeons are working out of these other two facilities, National Spine Joint as well as Riverwalk Surgical Center. This just gives you a little overview of some of these locations. So, Dr. Husick, why don't you talk about your plush fellowship experience?
So, I'm in the operating room, as you can see in the chart, pretty much 5 days a week. I do have a fellow run clinic that's on the afternoons on Mondays, Tuesdays, and Thursdays, and this primarily starts somewhere around 1 o'clock. And there's usually somewhere between 7 to 20 patients, and this is runs adjacent to Dr. Bellis's and Dr. Black's clinics as well. Um, So if there's ever any questions or anything like that, I could always ask them. But this is a full scope of management, meaning I'm seeing these people preoperatively, and I get to examine them myself, and I could agree with the suggestions that Dr. Black and Dr. Bellis planned, and I could make my own suggestions. So there's that level of autonomy there, and they're always open to hearing out the suggestions, and we have a discussion about these cases. And then obviously you get to operate on these people and then you see them post-operatively. And you get to manage obviously when, even the most arbitrary things, whether you when to remove sutures, when you start weight bearing them, right? And so you get the full scope and there's full autonomy. And obviously part of that is a trust system that Dr. Bellis has established with previous fellows. But that's a great experience in addition to the fellowship. And again, in the operating room 5 times a week. And so the other Wednesdays and Fridays are typically full OR days, whether it's with Dr. Bellis or Dr. Nemitz on Wednesdays, and then typically with Dr. Bellis on Fridays.
Right. That's great. And I think giving them the opportunity to see the pre-op patients and do the full workup themselves, separate from our scheduling, it really gives them that insight and help in decision making. You can see the case volume is pretty robust, and the procedures are pretty robust. We talked about that. There's also we learn about bill or they learn about billing and coding. We have a whole coding team that can help with that. We have point of care ultrasound at the practice. We do arthrograms and PRP. We have an in-office C-arm that Doc just used today to reduce some fractures. Reminded me to add this onto that slide. And then there's the educational opportunities, both the fellowship track lecture that we allow for our state meetings, posters, research, and all of the above. A couple quick cases just to show you a variety of cases that we're doing. We do plenty of MIS, both bone and soft tissue, tenotomy capsulotomies, as well as the bunions, slides, etc. We do a lot of the reconstructions with revisions. You can see that here. We do ankle replacements as well as revisions and fusions, total talus, femoral head implant, all the good stuff, stage procedures for totals, reconstructive fusions, fracture care. We do calcaneal fractures, talus, ankles, pilon, etc., midfoot. Soft tissue work. We do a lot of tendon transfers, removals, growths, etc. This is just to try to impress everybody, I guess. But the biggest thing I think that we've added recently is orthoplastics, and I think Dr. Husick has found that that's really a great addition to an already a well-rounded program.
Yeah, Dr. Bernstein has been a fantastic addition, obviously, to the fellowship. And for those of you who aren't familiar with him, he used to have a fellowship up in Pennsylvania before moving down here in Florida. So he has a plethora of knowledge that you can learn from. And again, even with him, even though I don't go to his clinic, I touch base with him pretty regularly on patients that we operate on, and you get the full scope, and you get the idea of how to work up the reconstructive ladder with these complex soft tissue defects.
Yeah, and it wouldn't be St. Patty's Day without a joke. And Dr. Husick knows that I am a big dad joke guy. So, what do you call a bulletproof Irishman? Ricochet. Ricochet. All right. I know you guys are laughing inside. Anyway, these are my past fellows. We're very proud of them. They did a great job. And then our upcoming fellow, his name is Sujit Johnson. We're excited for having him start. This is Dr. Husick, so at least you can see you've seen his face. And if there's any questions, you can certainly reach out to him or myself. Um, how are we doing on time? We're out?
Yes, thank you guys both
All
so
right.
much. Just a
Thank you.
one last question. What is your start and end date for your fellowship?
So it's a little bit flexible. We do start in usually July, and basically I don't know where I am here. We start in July. It's a 13-month program. Technically, it's not at all 100% 13-month. We like to have a little overlap so one fellow can train the other fellow, at least give them the insights, the backstory, a little bit of info, and I think it's been a much better way to transition. We're very flexible. There's no exact date, but we try to make it so that it allows for the variability in the time period for graduation and starting the new jobs and things like that.
No, that makes perfect sense. Well, thank you so much for your time.
Thank you guys. I appreciate it.
Okay, and so up next, we'll be hearing from the Phoenix Foot and Ankle Institute Fellowship. This is in Arizona, and this is Dr. Jeffrey McAlister.
All right, can you hear me?
Yes, we can hear you.
Wonderful. And can you see my screen?
Yes, we can.
Wonderful. All right, we'll get started then. My name is Keith Crenshaw. I'm the current fellow with Dr. McAlister over at the Foot and Ankle Institute Fellowship. See if I can go to the next slide. There we go. We're located in Phoenix and Scottsdale, Arizona. These are just two lovely pictures of kind of where we're going to be mostly located. We do most of our work in Scottsdale and Old Town. So if you haven't been or if you weren't there for the ASC that was recently there, it's a great place to be. It's a nice for about the majority of the year. Temperature wise, it does get a little hot in the summer, but most of the time you're in a cold OR, so don't worry about that. At the Phoenix Foot and Ankle Institute Fellowship, we have our director, Dr. McAlister, and we also have additional attendings that we work with. Dr. McAlister, as you know, did his training with OFAC, along with Dr. Larson, who also did his training, fellowship training at OFAC. Dr. Zachary Flynn, he did his residence training with D. Domenico in Ohio, and Dr. Mata Riniker did her fellowship training with Brigido. So they're all fellowship trained attendings and faculty that we work with. We do get a nice variety of perspectives on different types of cases, which is a wonderful experience and a lot of pro tips or pearls to have. These are the fellows. Of course, we've had four fellows so far, and with starting with Keegan, and then Ram and Michael, and now it's me. Our next fellow is going to be Daniel Lowe, so he's going to be coming up soon. Everybody was able to secure a job afterwards in a location that they wanted to be. I think that's something kind of unique is that so far each person's kind of had a location they had their eyes set on, and were able to find a job with the resources that both the fellowship and people around us are able to help out with, which is great. The Phoenix Foot and Ankle Institute has three main locations. The most common one you're going to actually be as a fellow located at and in their office is the Scottsdale office, which is right in the heart of Old Town. There's additionally a North office, which is on Thursdays. And then in Phoenix, there's the central office. And then that's more of both those are temporary, or you don't get to go there as often as a fellow because you're normally in the OR. So surgical locations, there's a big health system called Honor Health, in which we are normally scrubbing, most commonly in the outpatient setting. So there's multiple locations where we go for the outpatient setting. Additionally, with Dr. Flynn, we go to Banner University, which is the University of Arizona Medical University. Uh, as well as a surgical center where it's the Banner Atves Surgical Center, which we work with Dr. Larson, Riniker, and Flynn. And most commonly on Tuesdays, we go to the Arizona Specialty Hospital. It's kind of an outpatient inpatient surgical center. It has an outpatient flow with the ability to have people either stay overnight or for a few days as inpatients. So really unique kind of setup. Everything's focused more on these elective type cases, but we do have the opportunity for hospital-based cases as well. General schedule on Monday, we're going to be in clinic as fellows with Dr. McAlister. You do have your additional fellows clinic. You have your own patients. These are patients that you can book as primary cases, which is a wonderful experience. A lot of autonomy, a lot of ability to work up these patients and also schedule them for surgery. The nice thing is that you always have Dr. McAlister there to work with you and kind of bounce ideas off of and discuss. And there's a lot of difficult pathologies that come in that it's really a valuable resource to actually kind of have that person with you going through those more advanced cases. On Tuesdays, it's normally the OR with Dr. McAlister for the whole day. Sometimes Dr. Flynn is also at the Arizona Surgical Specialty Hospital. So if there are any cases still going on once you're finished, then there's always the opportunity to bounce over on Wednesday, normally in the surgical center with Dr. Larson. If cases are scheduled for the whole day, you just stay there. And if you end early, then you end up coming back to clinic with Dr. McAlister. Again, a great location to be able to see all your follow-ups and kind of see how these surgical outcomes and post-operative plannings kind of play out. On Thursday, we have the OR with Dr. Flynn. Most of the time, this is at the Atves Surgical Center, but again, on every third Thursday, it's the Banner University with the University of Arizona. Or if there's additional cases or add-on cases, normally that's going to be the OR with Dr. McAlister. And on Friday, you are normally going to be with Dr. McAlister, or if you get finished with cases early, helping out Rinneker or Dr. Flynn. So we have a lot of surgical diversity. I think this is one of the biggest highlights of this program is the fact that you have everybody's fellowship trained and has their own perspective and their niche and what they want to work on. You get a lot of advanced rear foot, forefoot reconstruction. I think in my first 2 weeks, there was a lot of total ankle takedowns, most things that are sent to us from other providers. But there's kind of getting your teeth cut on those was really great. We also have done a few allografts for total ankles for younger individuals instead of their standard oats, or if there's a large cystic lesion in the talus. We've also done total taluses for AVN or neglected fractures of the talus. We've done some limb lengthening as well, both through X-Fix or an invasive type nail, and then a variety of different total ankle systems, which is wonderful to kind of be able to experience each type and see the nuances of each one and kind of what you would want to adapt to your practice later on. There's plenty of sports medicine along with a lot of lateral stabilization procedures, including Crispin Snooks, which I know personally I didn't get to see often in residency, but it's a great procedure to have the experience with. A lot of MIS procedures, both for Charcot and bunion procedures or MIS Haglunds. There is diabetic limb salvage with Dr. Flynn more commonly, and he does a lot more Charcot patients. And then we do have pediatrics that we do see as well. The case volume generally is about 70 cases per month, normally on average about 3 procedures per case. So it ends up being, depending on, based off the last 3 fellows, it ranged just greater than 650 to 800 cases per year. The low end was because they were lucky to have a baby and just took a few weeks off. So it was a great experience. As you can see, there's just a few more of different procedures we do between MIS, TTT, ankle fusion, or 2 biplanar modalities for a cavo varus deformity and a tibial torsion. Other things that just more of the part of the program itself. Call is just clinic call. There's no hospital call or over weekend call. I think during my time at the fellowship, I've only had to go in on 1 or 2 weekends since the first beginning. That's about 8 months now. And then normally if I need to, I'll see any additional patients that may be in the hospital after clinic. But again, that's quite rare. Most commonly, we don't need to go and run to the hospitals to go and see patients. we do have courses and conferences that are covered. Most commonly, the ASC is going to be covered by the fellowship, along with fellows courses which you do with industry, and a billing and coding course, which is a requirement because there's a lot of billing and coding that you do within the practices, a private practice setting. So you do learn how to not only manage practice, but actually see the inner workings of how to do it, and you'll be able to, in a sense, do it on your own when you leave. So it really sets you up for success in that sense. A lot of the times I'm working with Dr. McAlister or Dr. Flynn. They'll encourage me to join them on consulting and industry involved teachings or labs or dinners, just to make sure that I understand how the best converse with industry, and in case I want to work with them in the future, which I'm going to. And charity events, there are two main ones that we do. It's a FSX golf charity event, and then also a walk to cure arthritis that we do with the Phoenix Foot and Ankle Institute. Research requirements, well, there's minimum is a one manuscript and one poster per FACFAS, but there are plenty of opportunities, and it's not likely that you'll end up in just having one manuscript, one poster. Plenty of publication opportunities between JFAS, Fast Track, and Podiatry Today alone, along with podcast opportunities, plenty of presentations from the ASC or other presentations more community-based or in Arizona with other fellowships. And then, of course, there's the opportunity to work with white papers or do labs with industry to kind of move yourself forward in that direction and focus on new techniques.
That's perfect. And thank you so much, Dr. Crenshaw. Sorry we're out of time, but thank you for...
It's just the application stuff. So.
Oh, okay, perfect. And there's your email address. And so if any questions, then is it recommended to reach out to you directly?
Yes, please.
Okay, that's perfect. Thank you so much. I really appreciate it.
Of course.
So next, we're going to be hearing from the Premier Orthopedic and Sports Medicine Foot and Ankle Surgery Fellowship. This is in Pennsylvania, and this is Director Spencer Monaco.
Hi, everybody. Hi, Dr. Wooten. Can you see my screen?
Yes.
Okay, great. Hi, everybody. My name is Younes. I'm the current fellow working with Dr. Monaco here at Premier Orthopedics and Sports Medicine in Pennsylvania. So just a quick overview for our fellowship. It's part of an orthopedic group focused on high volume orthopedic trauma, as well as other surgical cases, as well as emphasis on clinical management. Sort of the weekly workflow for us, it's very simple, 2 days in the operating room and 3 days in clinic. For one of the days of clinic, there's a fellows clinic I do in the morning where I see my own patients, do the billing, coding, and work up those patients on my own. In terms of kind of working with residents, we work with 3 different residency programs. That's the Phoenixville residents, Bryn Mawr residents, as well as the Penn Medicine residents as well. This is a kind of a great opportunity for me, especially kind of teaching residents in both clinic and the operating room setting, as well as kind of leading case discussions as well as surgical planning with the residents. Kind of the main goals for our fellowship obviously being getting hands-on experience, but kind of developing your own independent surgical decision-making, as well as exposure to practice workflow, and kind of working up your own patients, because at some point I'm going to be working them up on my own very soon here. Sort of the benchmarks for us, we do around 500 plus cases as a fellow. These involve anywhere from total ankle arthroplasties, minimally invasive surgery, trauma, sports medicine, as well as deformity correction and reconstruction. Just a quick, brief overview of Westchester. It's kind of a beautiful location, small town with a college feel. A lot of things to do around here, such as go to nearby parks, trails, outdoor activities, as well as enjoy kind of the local restaurants around here. So that's pretty much a brief overview of our fellowship. If there's any questions, feel free to ask now, as well as just reach out and send applications to Dr. Monaco, who's the fellowship director. This is his email provided below.
Perfect. And Yona, do you know if your program accepts the H-1B visas?
I would have to look into that. I have to talk to our practice manager about that. I'm not entirely sure.
That's fine. Anyone with questions can email Dr. Monaco. What would you say has kind of been the biggest surprise about your fellowship experience, like something that you weren't kind of anticipating to get during this year that you've been pleasantly surprised about?
I think it's been the orthopedic clinic side of things, just kind of working different types of patients from different age ranges and kind of coming up and formulating your own plan, as well as seeing through your pre-surgical outcomes or pre-surgical patients as well as your post-surgical outcomes.
Yeah, absolutely. And what do you think in terms of like attributes of a fellow like that your program is kind of looking for?
Yeah, so somebody who's well-read, somebody who has kind of a good foundation on surgical skill sets, somebody who's willing to be part of a high-functioning orthopedic practice, as well as being willing to do a lot of surgical cases, as well as be able to work with different residents, as well as adapt at different scenarios with the types of cases we get from the hospital centers.
Yeah, that makes sense. And then what is the typical like start and end date? And is there any kind of overlap with like the previous fellow before you kind of get fully going?
I think for us, we've established that our fellowship starts on August 1st and it ends July 31st. We do, for our next fellow coming in, typically we have them come at least one week to 2 weeks prior to at least shadow, as well as get used to how things run in the clinic as well as in the OR.
Yeah, that bit of overlap is always so helpful. So
Right.
wonderful. Well, thank you so much for being here and presenting. And then if anyone has any further questions, they can reach out to Dr. Monaco.
Great. Thank you so much, Dr. Lubin.
Perfect. So up next, we have the Wellspan Health Reconstructive Foot and Ankle Fellowship. And this is also in Pennsylvania. And thank you so much for joining us, Dr. Michael Younes.
Thanks. As well, one of my fellows is here, Dr. Judikis, who can talk at the end here. Thanks for having me. Great platform to get this marketing out for our program and other programs for the country. I've been doing this the last 8 years now. We've matriculated 13 fellows now. We take 2 fellows a year. We are located in both York and Lancaster, Pennsylvania, primarily out of Lancaster. The 2 fellows rotate with 2 different docs clinically, but with up to 15 different attendings surgically, both podiatric and orthopedic. We cover 2 hospitals, 3 ASCs, and our surgical volume really spans from A to Z. I kind of make a joke. It's everything from nails to nails, everything from routine podiatry all the way to IM nails, total ankles, trauma, a lot of revisional surgery, second opinion type work, MIS, pediatric stuff, whether it be flat foot, fair amount of peripheral nerve work that we do here. Sports medicine has been my kind of like go-to just because of my background as an athletic trainer. We do some trauma. It's minimal, I would say less than 10% of our cases, and our cases run anywhere from 350 to 400 cases. Truly, the fellows start to learn towards the springtime, they really back their surgical volume down. They could easily crack 500 cases, but they learn that the clinic is really where the rubber meets the road, so to speak, where they get their spiel down with their pre-op, intra-op, post-op workups and deal with all the complications that we see in foot and ankle surgery. My goal as a director is really to be that mentor for these guys and gals that come through our program. I want them to be 5 years ahead of their peers that they graduated school with just in 12 months. So that's kind of been my goal. I kind of feel like I have that recipe to get it right, matriculating these last 13 or so fellows, because we have that little recipe to fill in those gaps that residency didn't have for them. Between billing, practice management, whether they go into private practice, even private equity, all of our fellows have kind of spanned the gamut on where they end up in practice, whether that be hospital owned, PE owned, orthopedic and podiatric. Um, the fellows do run, I'll say, their own clinic. We don't call it a fellow clinic, but they run side by side with two specific attendings, both myself and Dr. Mulhern, who's the co-director. So there is a lot of autonomy with this program, but yet there's, that ear right next to me, or right next to them, that they can ask me any questions they need in regards to their own cases. They do their own cases. Specifically, most of that stuff is on call, but they do carry their own clinic load where they would do their own cases and be the primary surgeon, where I would actually assist them if they needed. It becomes more of an issue, not an issue, of finding that the clinic is really where, like I said, the rubber meets the road, and they figure out that that's where all the issues that you deal with surgery becomes the easy part. Dealing with the stuff in the office is really where you get really much, much better improvement over your peers at that same level. Billing is a big thing for us. We recently converted from private practice to hospital owned, but we still do a lot of that practice management stuff with them. They do attend all the industry events, Stryker, Arthrex, Paragon, and we've been fortunate enough to have a local Arthrex distributor has a cadaveric lab. So anytime we need to go over there, we can go and practice on any kind of instrumentation that they have, which has been a really good thing. We all take call equally during the week, and then the fellows cover the weekend. So they just rotate weekend to weekend. And then throughout the entire year, each of the attendings takes a weekend. So that's like, I think they get like eight weekends off on top of all the industry stuff plus ACFAS. From research perspective, we do the ACFAS posters and manuscripts, and I do ask that we either start or finish a peer-reviewed article from the class before, or start one for the next class. What am I missing, Sarah?
Honestly, you covered a lot. I mean, you talked about the diversity and kind of normal, kind of week by week. I guess you said we get a lot of autonomy. So I would say that when it comes, the fellows get to plan. We look at everybody, all 15 attendings, surgical schedules like the month before, and then we make our clinic schedule based on that. So some days we might be, or some weeks we might be in the OR for we could be in the OR every single day
5 days,
if
yeah.
there's cases that we really want to see or it's a busy month. Or we can, I'd say in general, we're probably in the OR 2 to 3 days a week and the other 2 days of clinic. And like you said, that kind of narrows down when we get towards the end of our fellowship, because that's what we're really kind of trying to hone in on and make sure we have those skills all knocked out. I will say the one thing that I guess he didn't really mention, but I think is really valuable. Not if some of my peers who are in fellowships haven't had this opportunity quite as much, but Dr. Younes and Dr. Mulhern do quarterly check-ins where they take the opportunity to make sure that you're getting everything that you want out of the fellowship. So they're really trying to make sure that you are either getting the skills down that you want, if you want more emphasis on billing and coding. They just want to make sure that, again, that you're getting the exposure and that you're meeting the needs that you feel like you need, that you're gaining what you want from fellowship, which I think is really valuable to make sure that you're, again, getting what you want out of the fellowship.
Yeah, we're pretty sensitive to the fact that these guys take an extra year to train, move across the country, kids, family, loan interest, all that. So we want to make it worth their while. And we feel it's been a real positive for those residents that want extra training. So it's been a great experience from both angles. And all of our attendings are very open to training and very open to, I'll say, pass the knife and kind of let them fly.
Definitely. I will also mention we at one of the hospitals we have an inpatient podiatry team. So during the week, they cover all of the inpatient podiatry consults and everything. So really on the weekend, you're just following up with some imaging, maybe taking a case, delayed primary closure, something like that. It's really very manageable. And once we joined the hospital system with Wellspan, since we're only with the two hospitals, if you live around the Lancaster area, it's definitely reasonable to be able to get to each hospital distance wise. It's not terribly difficult for call on the weekends.
That's wonderful. Thank you guys so much. I just have a couple of questions.
Sure.
Does your fellowship program accept H-1B visas?
We do.
Beautiful. And what is the start and stop date of the fellowship program?
So our contract runs August 1 to July 30. Typically, the fellows come up about 10 days or 2 weeks early. They work with the previous fellows, EMR, onboarding, credentialing, that kind of thing. They drive around to the hospitals and ASCs and kind of learn, where the ORs are, locker rooms, all that kind of stuff. So about mid July, I think this year's fellows coming in, they're starting on like the 20th of July. So they'll have a full 10 days of ramp up to get um, going on the first. We have been fortunate with the transition to the hospital. I think we're like one of the highest paid fellowships in the country, which has been another attractant for future fellows, which has been nice. And the bennies are really sweet now that we're hospital owned.
That's awesome. And for you as a director, what are you typically like? What are the characteristics that you're looking for in applicants and fellows to join the program?
Good question. I need someone who's can work autonomously, can take criticism, and come to work with 100% effort every day, like I give to them. So I expect that in return. I also say you get out of the program what you put in. If you're just going to show up for work and do the basics, you're going to get the basics. But we as attendings push these guys to really get them to excel at their field. So someone who's really looking to take it to the next level is what we look for.
That's awesome. And hopefully, Sarah, you can weigh in on this. What is the dynamic like with two fellows? Like, how do you guys interact? Like, is that research driven or kind of what does that look like?
Yeah, if it's all right that I answer Dr. Younes, I'll kind of touch on this. So we work because of the way that the year is set up. So half of the year I'm with Dr. Younes, the other half I'm with Dr. Mulhern. So the fellow and I switch. So we honestly don't really see each other very much when it comes to regular work weeks because one fellow is covering attendings on one side of the river and the other's covering the other. And clinic, we might have like one day that overlaps at one location where we see each other for a couple of hours, but we're mostly working together when we're setting up labs, when we're going to fellowship courses, when we're working on research, going to, learn about different products, industry related stuff. So we're not together a whole lot, but we definitely reach out to, I mean, we talk almost every other day, just to check in on certain things, make sure that we're getting any type of work done. Lately,
Case coverage.
work, yeah, coverage, credentialing, anything, emails, meetings, we're always kind of checking in.
Schedule is really fluid, and it's like she's got a job interview. She'll let him know, hey, Eunice didn't have any coverage. Like she was on a job interview last week, and Seth covered my 6 cases.
Mhm.
So they did a quick switch, and it's very fluid. And there's where I would say administratively, from a fellow, what I look for is someone who's strong administratively to take care of that stuff. I don't have time to babysit schedules. They take care of all that, and they benefit from it. So
Yeah,
it's a good deal.
Yeah,
definitely.
but nice to have that support there. Okay. And then if anyone has any questions, who should they reach out to?
So on the ACFAS website is all the emails, phone numbers, all that sort of stuff, and you can also catch us on Wellspan Health. Our fellowship page is up there.
Okay, perfect. Well, thank you guys both so much for
You
being
bet.
here.
Thanks for having us.
Thank you.
Of course. All right, and up next, we are going to be hearing from Valley Foot and Ankle Reconstructive Fellowship. This is in California, and we have Dr. Gan Golshteyn with us.
All right, thanks for having us, Donna. So I have the fellow here, Dr. Panko as well, current fellow. So we created a quick little PowerPoint. We could just pull up real quick. Elizabeth, do you want to share the PowerPoint? You're on mute. Is it working?
Yeah, 1 second here. Let's see.
Oh.
Okay, can you see the PowerPoint?
Yeah.
Okay.
All right. So yeah, we're in Fresno, California. We are focused on reconstructive surgery. We do forefoot, anywhere from minimal invasive bunions, open lapiduses to hindfoot. You can go next one. So the area, so we are in Fresno, California. We're in the Central Valley. So we're the 5th largest city in California. Our Fresno proper area has about 500,000 people, but we service around 1.2 million people because we also consider the surrounding suburbs that we get patients from. We expand anywhere from kind of the Stockton area all the way down to Bakersfield, where there's a couple foot and ankle practices in the area. We are one of the larger groups, though, if not the largest group. And then we're kind of central to everything. Los Angeles is 220 miles away, San Francisco 185. And then there's a lot of outdoor activities as well. Basically, the fellow rotates with 3 core faculty, myself, Dr. OG, and Dr. Rowe. And we are going on to our 2nd fellow this coming up year. We hold journal clubs about once or twice a month, and we also do joint fellowship academics with Dr. Solomon and his fellow of that year as well. So Dr. Penko can kind of speak a little bit more on her cases. If the fellow is board qualified coming in, they are allowed to collect for board certification cases. If they work up the case, just like any other fellowship, we want the fellow to work autonomously. If we can get 2 ORs running, the fellow will take 1 OR room. I'll take the next. The case is theirs from preoperative to postoperative workup, and they're able to log it for board certification as long as they're board qualified during that time. And then Dr. Penko could speak a little bit about her elective current and projected.
Yeah, so right now I'm about 7.5 months in. Kind of took a look at my numbers a few days back, and currently just looking at electives, I've done about 230, and then just kind of extrapolating based on the rate that I've been doing those, projecting like around 400 cases at the end of the year, just electives. And you can kind of see the breakdown of those electives in terms of like kind of primaries that I've taken in sports medicine and advanced recon. When talking about that advanced recon and RA column, I didn't include like triples, doubles, flat foot recon because to me that's kind of not really why I came into fellowship. That's like more like things you could see in residency. So I'm just looking at like, X-Fix, like ankle, TAR, ankle fusion, that kind of thing. Also some MIS stuff at the bottom there. And then at the bottom, you can see the kind of total cases, which is including inpatient work and things like that. So all said and done, projecting almost 600 cases total for end of my year.
So we work out of 3 hospitals. One of us is one of the busiest level 1 trauma centers. Then there's the Clovis Community Medical Center, which is kind of the nicer hospital, and then St. Agnes Medical Center. We work out of 2 to 3 offices. Usually the fellow will be in 2 offices. We opened up a 3rd office. So, as time goes on, we might fill that one up too with the fellow. And then the call schedule is shared with myself and Dr. OG. About 1 weekend a month, the fellow is on call, and we'll split the call. So the fellow will cover one hospital, I'll cover the other. And then we basically reconvene at the end of the day. Right now, the split schedule basically is surgery takes precedence. So a fellow has open access to surgical schedules. Again, we don't babysit. If there's a case going on, you go. I don't ask where you are. Monday, she'll be in surgery with Dr. Rowe or in office seeing pre-ops and post-ops. A lot of the diabetic care I take care of. The fellow, unless we're running behind, really doesn't do any of that. Tuesday's in office, and then Wednesday was surgery or hospitalist, as in call, and then Thursday surgery, Friday surgery, and then any weekend will be rounding and surgery as well. So a little bit about what's covered through the fellowship. We pay fairly well, 85,000 plus benefits. That way there's no stress for families, or I know during my fellowship, I had to pay between 2 rents. We are in a lower cost living area in Central Valley. So it's not like you're living in Los Angeles, which is really nice. We do provide $2,000 for CME. That's included in ACFAS. We do poster presentations, and then I have the fellow present at St. Mary's Residency Grand Rounds when applicable. 2 publications and then ACFAS posters, just like usually any other fellowship. And then right now, just a couple of projects we're working on is the TL Elevate through Orthofix, transverse tibial bone transport, and then some osteo work as well. So just a couple examples of some cases from Charcot, stage Charcot cases. I know Dr. Wines is on here. Please don't criticize any of these if you see anything. But external fixator, stage Charcot reconstruction, followed by hind foot nail. I think I got the thumbs up. That's great. I feel better. And followed by a hind foot TTC nail, guys walking happy. So you'll get a lot of Charcot reconstruction, staging, and Charcot is probably a continually evolving kind of work. So a lot of, my goal with the fellowship is the fellow to present the case and then come up with newer ideas, or like, hey, this is kind of what's seen in the literature. Let's talk about it. Are we beaming them? Are we doing a hind foot nail? And so I'm learning as well as the fellow.
Yeah, just to piggyback off that briefly, I've really felt collaborative effort with the other attendings. They really get me involved in discussing not what we're doing necessarily, because that's, you can look up in a book, but why we're doing things and why maybe certain steps that we did on another patient doesn't really apply to this other patient that we're doing today because of X, Y, and Z. So I've really appreciated that feedback and that collaborative effort and that team dynamic to really push you and make you grow. Oh, let me see.
Total ankle replacements, one of my favorites. So you do get your share of total ankle replacements. And as patients come, you work them up, whether it's revisional and you're using a stem implant or an acute total ankle replacement. And so just another example of a case, and I think this patient is actually doing his other side for the next fellow. So, you'll get that kind of component as well.
Code gray, room 467.
Pediatric. So I'm the only foot and ankle pediatric provider outside of a Valley Children's Hospital here. So that's very nice. So you get a lot of your D1 athletes, you get a lot of your high level dancers, you'll get a lot of coalitions, and you'll get a lot of the pediatrics. So all peds are worked up by the fellow as well, to kind of get your hands on to working with the kids, anywhere from toe walkers to infants to adolescents to neurological patients to complex deformity patients. And so you get your fair share of dealing with the patients and the parents as well. So you can kind of break that level of comfort. I know that's a weakness in a lot of residency programs. It wasn't mine. And so you do work with the kids here a good amount.
Yeah, that was one of the areas that really attracted me to this fellowship as well when I came and visited, just to see the amount of pediatrics that you're exposed to is really expanded my knowledge base a lot. So that's been a great learning point for me.
Yeah, and just a couple other cases, post-traumatic ankle arthritis, and just a couple of images there, but yeah. And you get your acute trauma.
Awesome. Thank you guys so much. And what is the program start and stop dates?
So we start August 1st. We end July 31st. So after residency, you get about a month. We do recommend that the fellow come about 10 to 15 days prior, get familiar with the area, move in, get comfortable, get their badges going, and then do their EPIC training if appropriate. That way, August 1st comes around and they're ready to go.
And does your program support H-1B visas?
As of right now, no.
Okay. And then future questions, who should they reach out to?
So on the ACFAS fellowship website, there's the emails of the program coordinator, my email, and then those get forwarded to myself, and then the current fellow, and then the future fellow.
Awesome. Awesome. Well, thank you guys so much.
Yeah. Thanks so much.
Thank you for having us.
Have a good one. All right. Next, we are going to hear from the UAB Advanced Pediatric Reconstruction and Limb Salvage Fellowship. This is in Birmingham, Alabama, and we're going to hear from the fellowship director, Kyle Mock.
Hey Tonda, how you doing? Nice to see everyone. Thanks for having me here. This is our first time running through a fellowship Zoom room as we're currently in our first fellowship year, so we're excited to be here. I also currently serve on the fellowship committee with Tonda and some others, so it's great, I think, for our profession as a whole just to see the variety of different offerings that we have from programs throughout the country. So really excited to be here. Let's go ahead and share my screen and see if we can get this PowerPoint up and operational. Can everybody see that?
Yes.
Perfect. All right. So this PowerPoint was actually created by our first fellow. His name is Jonathan Garcia. I told him that I wasn't going to look at this presentation. I was just simply going to present it and then collect feedback on the quality of the presentation for his evaluation for this quarter. So here's my email. Any thoughts on this? I'm only joking, but again, here's my email for any questions about our program that might arise. So, as we've already mentioned, we are currently at the University of Alabama in Birmingham. UAB is the largest academic medical center in the Southeast. It's a major hub for care research and medical education. It's home to the UAB Hastings School of Medicine, which is where our program lies. We have a ton of nationally recognized programs in orthopedics, vascular, transplant surgery, cardiovascular medicine. So it's truly a large tertiary care academic medical center. Patients are referred from all over the place. I had a patient from Georgia and Louisiana and Texas all in the last week come to see us. So it really provides a nice, strong emphasis on multidisciplinary specialty care from a large geographic region. As I already mentioned, it's also a level one trauma center. We have dedicated care teams across multiple specialties. One of the biggest advantages that I think we have is the huge exposure to complex referrals from the surrounding service network. We're a safety net hospital, so as other programs have mentioned, we get a ton of second opinion referrals or revision work, complex cases that people send to us that they don't feel comfortable tackling in the community, and there's huge case diversity. So about our program in particular, like I mentioned, we are currently in our first year. So we are conditionally approved through ACFAS. Once we matriculate Dr. Garcia at the end of July, hopefully we will be fully approved via the ACFAS. We take one podiatric fellow per year. And the focus of our program is complex limb salvage, reconstruction, and that multidisciplinary approach, which we've already talked about. If you're a candidate and you're looking for acute trauma, total ankles, things along that nature, this program isn't for you. But if you're someone who's looking, for a more limb salvage based program, Charcot reconstruction, external fixation, hindfoot nailing, deformity correction in high risk dysvascular patients, diabetic populations, then we should be right up your alley. We are primarily housed at the UAB main hospital and the UAB Highlands Hospital, which I also think is a big advantage for our program. These hospitals are located a whopping 4 blocks apart from each other, so our fellow doesn't drive between to hospitals or multiple cities or anything like that. We are in collaboration with the multiple various specialties, some of which are listed here. The mission of the fellowship is to train podiatric surgeons to become leaders in these things that you see here, and some program highlights, which we've already talked about. When we designed this program, we really wanted this program to be fellow forward, meaning this program wouldn't just be where our fellows were treated like PGY4s. And so, what a typical week looks for our fellow is basically he's in the operating room 5 days a week. He does have a small half-day clinic that is entirely his. UAB credentials our fellow as what they call an instructor fellow. So he practices under his own license, his own DEA. He's fully credentialed by the hospital, so the patients that he sees in his clinic are truly his. If the fellow coming in is ACFAS qualified, then those cases will certainly count for board's numbers. When he's not in that clinic, he's in the operating room with the attendings that we have. We have 5 full-time faculty, so a very busy program. Everyone is always operating all the time, and so I think we reviewed his numbers a few days ago. I think he's around 450 cases now with a few months to go. So a lot of volume, a lot of diversity. He also participates in the call pool. We put him in there just like an additional attending. So it's 1 week of call responsibility every 5 or 6 weeks, kind of depending on how the schedule aligns. And overall, I think we've designed something that's pretty compelling from a potential candidate standpoint, and something certainly that we've enjoyed watching grow and hopefully take off here over the next year or so. Some more things that he included, just core clinical and surgical training. You can read all of that. And then again, one of the values of training in a fellowship year at a large kind of academic tertiary medical center is exposure to all of the different services. We also have the unique ability that if a fellow comes to us and feels there are other areas of his multidisciplinary training, he or her multidisciplinary training that they want to focus on, whether it be a vascular rotation or a plastics rotation or an infectious disease rotation or something along those lines that they feel they need additional training in, we can certainly facilitate that rotation with our other service lines that we have here. Um, and I think all of this we've pretty much covered. So I think that will be that. I will stop sharing and then open up to any questions that anyone has.
Do you all accept the H-1B visas?
So yes, interesting question. And I just got confirmation about this today. We will. It's a whole lot easier. I've learned that if a potential applicant has a current visa status, to contact us about their involvement before it expires, and we need to essentially resubmit the whole paperwork. But my understanding as of now is yes, we will consider those candidates.
Awesome. And then you as a fellowship director, like in starting this program, like what attributes are you looking for in like prospective fellows?
Yeah, great question. And by this time of the night, we've heard from a lot of other directors, and I probably will echo a lot of their sentiments. Again, to be successful here at UAB, because it's such a large and dynamic practice, we really are looking for kind of self-starters and self-motivated individuals who want to come in and work. Again, the whole mindset of this fellowship is that the effort that you put in will directly reflect the benefit that you receive in return. And so we will never treat you like a PGY4. We want this to be collaborative and dynamic to where you're pursuing interests for your own career advancement, and we're here to provide mentorship and help you achieve those. I heard someone earlier say that the reason why they do this is they want their fellow to be 10 times better than they were. And I think that that really is something that resonates with us too. We want to train people to come out and pick up the baton and really continue to move our profession forward. And so I think that would be kind of my ideal candidate, was someone who is willing to jump in and get to work and have us help them along the way.
That's awesome. That's awesome. Well, awesome. Thanks so much, Kyle. And then we'll send out your email address. So if people have more questions, they'll reach out to you directly.
Perfect. Thanks again. Nice to see
Sounds
everybody.
good. Have a good night. All right. And last but certainly not least, we have the University of Maryland Limb Preservation and Deformity Correction Fellowship. And we have Jacob Wines here.
Great. Thank you so much for having me, Dr. Wooten. I'll start off by saying August 1st and H1 no, J1 yes.
H1 yes, J1 no. Got it.
No, no, other way around.
Other way around.
No H, but we take the J.
Perfect. Thank you
All
for
right.
answering my questions
Okay.
before I
Is that
get
it?
to
Can I
them.
go? No, I'm kidding.
Yeah.
I mean, like, I want to leave tired. Yeah. Hold on. Let me just share my screen. I apologize. Here we go. All right. Can you guys see slideshow?
Yes.
Good, good. All right, let me just minimize this. A little distracting. Oops. All right. So we're at the University of Maryland School of Medicine Fellowship. First of all, I just want to point out that this fellowship initiative is fantastic. I mean, just being on this Zoom room, the fellowships are just beyond anything that I would have ever imagined to be possible within our profession. And just the bar just keeps getting set higher and higher. So congratulations to all program directors out there and applicants. So why fellowship? Well, for me, I wanted to smoke in the operating room. That's not really true, but the reality of it is that I needed something that was going to be more of an additive to my existing training. I felt that most fellowships, in my opinion, do better when there's a kind of a theme and a added benefit more than what they've gotten in their own residency training. So for me, I think lineage is very important to me. I'm very fortunate to have trained under people that have trained under people that have trained under people that have been quite successful and excellent surgeons. And I do feel like that's important to keep perpetuating that and keeping the family tree going. And I do believe in pedigree as well as the need and search for education sort of beyond what you've originally gained. Our fellowship was actually established in 2019. Certainly she's not on here, but Vicki Norton was the orthopedic residency coordinator that essentially helped us get the fellowship off the ground at the University of Maryland School of Medicine. Uh, to my knowledge, it's the first formal program that is both co-sponsored by the GME as well as the University of Maryland Orthopedic Department. And this is what this slide shows. And thankfully, we did achieve our ACFAS recognition status for a number of years. We were conditional and moving on to recognized 2019 and finally recognized in 2020. Here's our fellowship coordinator, Polly Zimnock. Her email address will show up twice. She's a great resource and can answer some of the logistical questions, but certainly I'm available as well, and I'll leave my cell phone number at the end. Here's our core faculty, a new hire, Dr. Michael Berger, a new hire, former fellow, Dr. Amanda Chow. And gosh, I mean, according to LinkedIn, it's been 11 years, 11 months, and a few days since I've been in practice. We have some multidisciplinary faculty. I'd like to highlight Dr. Nagerseth from vascular surgery. We have Dr. Marcus Shadini from orthopedic traumatology. We have Dr. Hempen from orthopedic traumatology and Dr. Vincent Ng from orthopedic oncology. And it's not too infrequent that we do cases in tandem with these individuals. Actually, thoughts and prayers out to Dr. Hempen. He's currently in Qatar. Heaven knows what's going on over there, but unfortunately, he's serving our country now. So hopefully, he gets back safe. Past fellows, Dr. Nicole Cates from MedStar Georgetown, practices in a hand and microsurgical group out in San Francisco. Corey Dubois from UPenn Presbyterian at the Wilmington VA. Lexi Shoup at Kaiser right now from University of Pittsburgh Medical Center. Dominic Cachado, Mickey Mouse's podiatrist in Orlando, Florida, but in reality, he's got a faculty appointment at University of Central Florida, and he graduated from Grant Medical Center. From Legacy Health, we have Dr. Chow, who's now with us at University of Maryland. Christopher Birkelback from University of Pennsylvania, President Presbyterian Medical Center, is now in private practice in Vineland, New Jersey. And last but not least, our seventh fellow. I believe this would be the second toe on the opposite foot. And here we have Salvatore Fazio doing his thing. So missions and goals, I don't want to really bore anybody on here, but there are actual key competencies and goals set forth in keeping with GME requirements or ACGME requirements or mirroring ACGME requirements, not to get political, but certainly our program does follow those constraints and does abide by those certain valuable capstones and competencies that are laid out. So unique aspects to our fellowship is, Baltimore is an urban setting. Just if you're concerned, then you get past their metal detector and it goes off. Just say the word laptop, and it doesn't matter what you're carrying. They'll just let you right through. But it is a very underserved patient population at times. We do cover various clinic locations, all of which are slightly different. But if there's any questions about that, Sal can certainly fill you in. But we have a large breadth of the entire patient experience. Obviously, we do chronic wounds and are very vigilant. We don't usually accept amputation for a solution, and even if it's necrotizing fasciitis, we do our best. Here's a patient that was so happy I was able to receive a Red Lobster gift card from him. We do complex reconstructions, hydrofusion nails, and the like, intramedullary lengthening, both with external and internal fixation, uh, cavus foot reconstruction, again, diabetic foot, but with a flavor of decontaminating bones, resecting bones as needed, and providing stable functional extremities towards ambulation. Pediatrics too, so treat everything from newborn to as old as they get. So we do clubfoot casting, Ponseti method, and dealing with all the social constraints of, again, on the underserved population, being compliant with boots and bars and everything else. Here's a older version of a clubfoot and an older adult that also landed on my doorstep. Computer-assisted hexapod is not uncommon. Certainly, there's an indication for everything, and I don't think that if you have a hammer, everything should be a nail. This is all to be taken not very lightly and to be used only when needed. And it, again, just for those in the audience here, it's not just a wound scraping fellowship, it's not just a frame fellowship, it's not just a Charcot fellowship, although that is the underlying bulk of what I get in referrals, but I also deal with, as many on this meeting have seen, a lot of revision work. I do pediatric flatfoot, complex reconstruction. What I tell often people in my family is that I take high things and make them flat and take flat things and make them high. Bunion deformity, pretty reproducible lapidus construct, supramalleolar osteotomy, Achilles tendon repair, arthroscopy, and I do consider this to be a hybrid of a hardware removal fellowship. You'll be quite proficient at that. And again, it is a greater progression towards autonomy. The video to the right is hysterical. I think it's just my former fellow Dominic Casciato just literally regulating the OR and kind of telling people where to go, where to put things, and it's just really neat to see when that happens. Certainly, we alluded to this, our collaborative team with orthopedic traumatology, in addition to orthopedic oncology. Also part of the limb preservation program, which is a now nationally recognized limb preservation site at the University of Maryland Medical Center. And very fortunate this past year, Dr. Christopher Birkelbach was able to be our first fellow to be invited to lecture with all the other residents and fellows at the University of Maryland Department of Orthopedics, resident fellow disputations. It was quite extraordinary. He did one heck of a job presenting our research and patient-reported outcomes in Charcot. And Salvatore Fazio will be the one taking the reins next. So looking forward to hearing him present. Typical clinic schedule, Monday OR, Tuesday at Midtown Wound Healing Center. That's where the bulk of our financials come from. If fellow typically costs about $85,000, so the money's got to come from somewhere, and the wound centers will provide that. But I do think it's an autonomous environment where one can book cases, see cases, have patients come regularly, maintain those patient relationships. And I do think it has been actually something that I thought was going to be somewhat burdensome has become to be quite a win for the fellowship program. We're in the operating room Wednesdays. Thursdays are the office and clinic. If there's a community provider that's doing OR cases, certainly welcome to scrub those as well. Friday mornings are shock trauma outpatient pavilion where we literally see up to 40 patients in 2.5 hours. Afternoon is either research, administrative time, but has been with operating room time as well. Our clinic site's University of Maryland downtown campus to the left. Top right is University of Maryland Midtown campus, and the bottom is what I think is very interesting in that this University of Maryland Rehabilitation Orthopedic Institute, which for those history buffs out there, this is the birthplace of North American Ilizarov deformity correction, as Dr. George Paley and John Herzenberg set up shop in Woodlawn, Maryland at University of Maryland Rehabilitation Orthopedic Institute, formerly known as Kernan Hospital, and brought literally limb lengthening to North America right in Baltimore. Happy to say that we do have the option of working with Dr. Mark Linzer for sports, ankle replacement, and cold trauma, and then Dr. Dan Perez for high velocity trauma and total ankle replacement as well. We have didactics, Tuesday morning, preoperative conference, weekly research discussion, monthly Zoom journal clubs with the residents, case conference the first Wednesday of the month, And I do like to groom the fellow for speaking. I do like to groom the fellow for potential opportunities towards expanding the research. We also have plenty of research opportunities with respect to lectures and workshops for research as well at the University of Maryland Medical Center. But I do like to have the fellow be given the opportunity to practice lecturing, getting on the podium. And as Dr. Malk pointed out, I do want them to be 100 times better than I was. We have published some of our highlighted work is listed here. Several posters and abstracts have been presented at various meetings, and certainly we've given podium presentations and have won several research awards. That's about it. This is my cell phone number, the office number if you want to talk to Polly. Here's email if you want to email Polly, and that's my email address, but certainly feel free to call or text anytime. Very much open to anything and any questions. Thank you.
Amazing. Thank you so much. And you already answered my 2 questions. So you are off the hook to enjoy your tie-dye party behind you.
Alexa, say hi.
Nice. Hi. Hi. She had to suffer through which program will she choose? She has so many to choose from tonight.
She doesn't want to be a doctor.
Ugh, breaking
Alexa, what
our
do you want to
heart.
be when you grow up? Come on. What are you talking? Oh, never mind. I think she wants to be a lawyer.
She's on the spot.
Yeah.
She's on the spot. Well, that's, we need those too. So awesome. Thanks so much, Jacob. So
A lawyer and artist. There you go.
you could do both. Why not? So, but thank you all so much for being here tonight. All of these things were recorded, so if you want to go back and re-listen to them or listen to some of the other Zoom rooms, they will be on the FACFAS website within the next couple of weeks. I really appreciate you guys staying up late and listening to this, and the directors and students and residents for all your time. And so everyone get some rest. And tomorrow, Maddie will send out email lists with all of the directors with their contact information. So if you think of any questions, then please email those to the directors and their programs directly. Otherwise, have a great night.